Patient Talk.
I'm Dr Hilary Jones. I'm a GP and I'm a medical broadcaster.
So what is the common cold?
The common cold is an infection caused by a group of common viruses affecting the lining of the nose, throat, windpipe and larynx.
So what are the main symptoms of the common cold?
Well, most people will suffer from a sore throat. They may have a runny nose or a congested nose and a cough. These are the commonest symptoms.
So how is the common cold treated then?
Well, despite the myth that still goes around about antibiotics have no effect whatsoever on a cold caused by a virus. So people shouldn't push their GPs to prescribe antibiotics. They'll do more harm than good. They certainly won't help the cause or the duration of a cold. The best treatment really is to treat this symptomatically. So if your nose is bunged up or running, then there's certainly you can use antihistamines and decongestants. If you have a sore throat, there are anesthetic lozenges you can use. And if you have a cough, there are a number of remedies, including just natural steam inhalations and herbal things. But the good news is that new evidence has come to light showing that there's a single formulation that works with any type of cough. And again, debunks the myth that different types of cough have to be treated with different remedies. There is one that can treat all types of cough.
So what might be the complications of a common cold?
Well, the common cold can cause inflammation, redness and roughening of the mucous membranes lining the nose and the throat and the windpipe. And in turn, that can give rise to a secondary infection with a bacterium. And it's the bacterial complications which are most threatening to groups of people who are more vulnerable and frail, such as the elderly, who can develop a secondary pneumonia as a result of a cold. But provided the symptoms are short-lived and people feel pretty well, their appetite's all right, they haven't got a temperature, usually the common cold is short-lived and self-limiting.
So how can a cold be prevented from spreading?
Well, because common colds are caused by viruses which can be expelled when people cough or when they sneeze, and which can then in turn live on hard surfaces which people can touch with their hands and then transmit the virus from their hands to their eyes and their nose and their mouth. It's important that people use tissues when they cough or sneeze and that they dispose of those tissues carefully. And it's important that everybody frequently washes their hands, because simple hand washing can prevent many of the viruses that live for quite significant lengths of time on hard surfaces from reaching people's mouths and noses.
Are there different types of coughs?
Well, coughs are classified by the kind of symptoms that they have. So it might be a dry cough, it might be a productive cough with lots of phlegm, it might be a wheezy cough associated with asthma. So people do describe different types of cough. And traditionally, people have always selected coughs that claim to say they're best for treating dry coughs or productive coughs. But now we know from the largest clinical trial of an over-the-counter cough medicine ever to be conducted in the UK that there's one formulation which reduces cough frequency and nighttime disruption from coughing in every type of cough, which makes the choosing of a cough medicine so much simpler for consumers.
So what sources of good information would you recommend?
Well, the formulation I'm referring to is called Unicough, which contains 3 well-tried and tested, scientifically proven ingredients, plus the ingredient of cocoa, which gives Unicough a very viscous, sticky ability to soothe and calm and coat the mucous membranes that are affected by the common cold. And you can get further information on this from your pharmacist, or you can go to the website unicough.com.
And then what myths about the common cold would you most like to dispel?
I think the two main ones are, firstly, that you can catch a cold from being cold. You know, our mothers and our grandmothers used to say, don't go out with wet hair, it'll give you a cold. It won't. The cold temperature won't give you the virus which causes the common cold. And I think the second most important myth is that antibiotics are going to be useful when you've got a cold that lasts for more than a few days. Actually, antibiotics have no value in treating the viruses that cause the common cold.
Perfect. Well, thank you so much, Hilary.
Pleasure.
That was great.
Pleasure, Emily.